Hi, I'm Dr. Wilcox. Today I'm going to be talking to you about a condition that's very common in our practice. It's a condition called Polycystic Ovarian Syndrome, or PCOS. It affects about 1 out of 10 women in the United States. And if you don't have it yourself, you probably know someone who does have it. It is believed to be caused by insulin resistance. In fact, many of these patients have been diagnosed to have an insulin receptor defect, which makes it difficult for the cells to get the glucose into the cell, and the patients will produce excess insulin. The findings for patients with polycystic ovarian syndrome include irregular cycles. In fact, most patients won't ovulate routinely, so they can skip several cycles, several months worth of periods. That's sort of a classic finding in these patients. The other findings include hair growth. Unfortunately, the hormone levels can be impacted, as we'll learn in a few moments, by the insulin indirectly through the ovary and the adrenal gland, leading to excess male hormone production and hair growth. In addition, patients tend to gain weight and be more obese with a higher BMI. Many of them have a body mass index over 30, which is considered in excess of optimal body weight. Patients do have findings on ultrasound. The ovaries are enlarged. The central part of the ovary is especially impacted, called the stroma. The insulin is believed to stimulate the central part of the ovary to grow, and this is the area we believe that is responsible for reducing the excess male hormones. Androstenedione is a precursor to estradiol, and it leads to a lot of other male hormones in the body. So the ovary is impacted in addition by arrest of maturation of the follicles, so you tend to get these large ovaries with a central expansion and accumulation of small follicles in the perimeter of the ovary. So it's a classic description as a polycystic ovary. To have the syndrome, you should have excess male hormone and ovulation or irregular cycles and polycystic ovaries on ultrasound. We see a lot of patients in our clinic because if you're trying to get pregnant, you often will have difficulty because your ovulation is either non-existent or incredibly difficult to predict. And those patients can be very easily treated with ovulation induction agents. Clomiphene is an oral medication that's very popular that will treat 85% of patients successfully, make them ovulate. And those 15% that are refractory to clomiphene will respond to the natural product, the follicle stimulating hormone, which must be injected. Now, patients with polycystic ovarian syndrome do have long-term issues related to the male hormone access. You can have male pattern balding, you can have problems with hair growth, especially in your abdomen, back, arms, and legs, even in your face and on your chest. So we can assess the amount of hair growth using a scale that has been determined to allow us to diagnose whether or not we think you need to be treated. There are things that can be done besides laser treatment. We can actually give you an antihypertensive drug that will reduce the hair growth called spironolactone. And for the hair loss, we can give you finasteride, which is a drug to help reduce male pattern balding. In addition, many of these patients will go on to develop diabetes, type 2 diabetes, and we recommend that you try to eat healthy, exercise, and most importantly, maintain your weight. You should be periodically screened for the insulin resistance, and if your sugars are no longer in good control naturally, then we can give you additional agents to help manage your blood sugar levels. Patients who are pregnant are more likely to go on to develop gestational diabetes. It's like a stress test for those patients who are pre-diabetic. There's a factor produced by the placenta, human placental lactogen, which will make you more insulin resistant while you're pregnant. So those patients definitely need to be screened before pregnancy for diabetes, and they need to be screened early in pregnancy to determine whether or not we need to do more to control their sugars during the pregnancy. Fortunately, the prognosis for patients who are going through fertility treatment with polycystic ovarian syndrome is excellent. In most cases, the only factor we identify for those patients is the anovulation or lack of releasing the egg. So we can simply give them agents to make them ovulate, and if the sperm is normal, the fallopian tubes are open, simply getting them to ovulate will allow them an excellent prognosis. In fact, 50% of patients with a normal evaluation, once ovulating, will conceive within 3 months, and 75% roughly will get pregnant within 6 months. So overall prognosis for the fertility treatment is excellent. So if you do have issues with irregular cycles and you would like to be diagnosed, whether you have polycystic ovarian syndrome, you can definitely make an appointment with a fertility specialist and they'd be happy to help you. And if you're having difficulty getting pregnant, of course, that's our specialty. So hope that helps. Thank you very much.